Well, this is breaking news that's been so eagerly anticipated. As you said, the European Medicines Agency moving forward the date of a meeting that was originally scheduled for December the 29th. So before the end of the year, bringing that forward to next Monday, December the 21st. Now, the European Medicines Agency, it's a scientific, apolitical body which reviews all of the scientific data, and it gives its recommendation to the European Commission. So legally speaking, it's actually the European Commission who gives the full green light for these vaccines to be rolled out. The European Commission pretty much always follows the EMA what to say. So if the EMA says yes on Monday, it will publish some more data a couple of days later. And indeed, this vaccine could be deployed in European member states by the end of this year. Now, you mentioned there was quite a lot of pressure on the EMA to bring forward this meeting, particularly from Germany. Germany, the biggest European Union member state. It's also a country that's seeing a whole load of almost record daily infection rates in the last couple of weeks. And they're going into quite a strict national lockdown tomorrow, all the way through until January the 10th. Now, the German Hospital Association, the German health minister had all been saying, look, we need this approval as quickly as we can get it. And Germany is ready to start doing those jabs. The German health ministry says that as soon as they've got their hands on those vaccines, they're going to start rolling them out to as many people as possible. And his prediction is that they can get it out to 2/3 of Germany's population by the start of the summer. That's starting to get towards that crucial herd immunity level.
Now, Catherine, just why aren't there any vaccine authorisations yet in the rest of Europe beyond the UK? Is this for safety reasons, or is this just another case of red tape slowing the whole process down?
Yeah, there's been a lot of questions asked about this. People looking at the United Kingdom, the first country in the world to deploy this BioNTech Pfizer vaccine, and saying, look, it's just across the English Channel. What's the difference? Why have they got it and we haven't on continental Europe? The answer is basically that there is a different procedure that's being followed. And there's also a question of trying to coordinate 27 member states at once, of course. If you look at the countries already issuing this Pfizer BioNTech vaccine, we've got the UK, gave December 3rd, started giving those jabs out on the 8th, then Canada authorising it on the 9th, and the United States on the 11th of December. Now, those countries have actually used an emergency use provision in each case, whereas the European states are waiting for something much more like the standard licensing procedure that any vaccine or any drug would get from the EMA. So that means European countries are waiting for a slightly longer procedure, but there have been various voices, including the German health ministry, saying, look, we really do need to balance speed, which is crucial, but also public trust, which we know is not necessarily at its highest when it comes to these vaccines. So the EMA says it's going as fast as it possibly can to get through all this data on this vaccine. Normally, it takes about 210 days to get this authorization. They say we're looking at fewer than 150 days. And once it's given the authorization, that will be valid in 27 EU member states all at the same time. They'll be able to start receiving those tiny little vials of vaccine, and then it's up to each member state to start issuing them according to their own national public health policies. So, as I said, it looks like there could be some jabs of this Pfizer-BioNTech vaccine happening by the end of this year. That's what many, many people are hoping for in any case.
OK,